I've been a cosmetic surgeon for about 30 years, and all of that has been here in Denver. All of it has been focused on doing the head and neck only, and that's my passion. That's what I truly enjoy doing.
There is an artistry to his work that sets him apart. It's like none I've ever seen. I actually sought out to go and work alongside him, and I have been doing that for 9 years this month.
When we work on someone who's younger, like Lorraine was at 47 years old, we're not trying to make huge changes. We're trying to make subtle differences, but these subtle differences can have a profound effect.
When I would see myself in pictures, instead of everything lifting up and looking youthful, it was going back. So it made my face look more round, more square, more full.
People would have looked at her before surgery and thought, you don't need this done. Are you crazy? But what she saw was some looseness around the mouth, a little looseness in the neck and the cheek and the jowl, squaring off of the face, which can occur as people get older. She saw that every time she looked in the mirror.
I was diminishing myself a little bit. I was shrinking. I was not wanting to be as social as we were used to being because I didn't think I would present in the way I was used to presenting. I was almost hiding.
And so she came in. We then talked as patient doctor, not as practice manager doctor, and I talked with her as the patient. I then was able to address the concerns and issues that she had, and when we looked at them in that realm, I could see the advantage and the benefit that she would have to having these procedures.
Patients ask me, well, Lorraine, you mustn't even worry when it comes time to you having a procedure, you just show up and do it. And I say, no, I'm human. I have fears around it as well. I think certainly we can fear anesthesia a little bit. We can fear, is it going to hurt? But I tell them with absolute confidence, I never fear the result.
She looks natural and looks pretty. And she is a great representative for my practice.
I'm telling you, a week into this, I was bouncing off the walls. I was driving the girls at work crazy. Like, could you go back to your office for a minute? And it's just because I was unburdened. I was unburdened with the fear of aging.
When I see Lorraine now, her shoulders are back. She's proud. She feels good about who she is. She projects well to our other patients. She is a tremendous advocate for them.
The work Dr. Smith has done on me has been a powerful resource for patients. I honestly couldn't have known the impact it would have on their decision-making process. It's almost as though they give themselves permission after they see my face and see that they say, oh my gosh, I never would have thought you had anything done. And it allows them to think about it a little differently. It allows them to set aside some of the fear of what they see in media, in magazines, and think, okay, maybe this could be a possibility for me. And I let them get right up in there. I pull my hair back and let them see where he makes the incisions, and they say, well, where? I don't see it. Exactly. You don't see it. It's invisible. You will be able to wear your hair up. We're not going to do anything that would limit you living the rest of your life. We don't want to give you anything that you would then feel self-conscious about. We want you to put your best face out there, and that's his work.
Hopefully, when I talk to them, I create confidence. When Lorraine talks to them, she creates comfort.
I think women are asking me to validate their want for doing this. And every day I'm asked, oh my gosh, is this vain? And I say, well, I actually see it as a form of maintenance, just like we put color over our gray hair, or we work out to maintain the muscle of our bodies, or even maybe get plastic surgery after we've had our children and things have shifted through that process. We bring it back where we want it to be.
A lot of what we do, our entire staff, is to be there for the patients, to be there to hold their hands, to lift them up, to make them feel comfortable, make them feel confident that they've made the right decision so that they can move forward and then allow me to do what I do.
How many hugs do you give on a daily basis?
A lot.
A lot.
With Dr. Smith and seeing his work and realizing that it is just so natural and it's just a way of helping to maintain that youthful energy about yourself, I think we should all give ourselves permission to do that.